I am like raging with anger right now to the point where like I want to say a bunch of like bad words. I'm Dr. AK with the Whole Human Health and Wellbeing. I'm a board certified emergency medicine and lifestyle medicine physician, and I focus on taking care of the whole human to keep you healthy on the inside and healthy on the outside. And so the reason I'm raging is because, by the way, my kid forgot his lunch, and so I have to now make a sandwich and deliver that to school. So I'll be making a sandwich while raging. Anyways, women's healthcare is like an absolute joke when it comes to evidence and knowledge that people have. So somebody was talking to me about how awful they feel. And literally everything that they said meant the criteria to diagnose like perimenopause. And she told me that her doctor got hormone levels and they're all normal. And so it can't be that. And so then she started, and this started with her like 2 years ago. Then she started with like this other person who I don't think is a board certified physician from like what I gathered, who is treating her with like hundreds of dollars of these vitamins and supplements for like maybe hypothyroidism. Okay, there's a lot to unpack here. So first of all, hormone levels are not a thing when you're in perimenopause. It is crazy. It's a roller coaster. Like hormones are doing this. So one day they might be normal, like a couple days later they might be insanely high, and a little bit later they might be like undetectable. It's that roller coaster of hormone change that causes a lot of these symptoms like brain fog, but body aches. Yes, body aches is a thing. There is a musculoskeletal syndrome of menopause that exists. Right? Recurrent urinary tract infection, pain with sex, inability to climax anymore, low libido. Like there are all these things that are out there. And while yes, I do check thyroid function in people where I think, oh damn, this might actually be their thyroid. I check it. I even had one person who came in and was like complaining of all these things. And I was like, yo, I think you might actually have sleep apnea. Like we can still treat perimenopause. I'm not saying that's not a thing, but like, I think there's other stuff going on too. So like, yes, medically there can be other stuff going on and we need to treat those. But just because your hormone levels are normal doesn't mean it's not perimenopause. And so this woman like shelled out thousands of dollars in supplements when like, these medications are FDA approved medications that most insurance companies will cover. So like, I'm really angry about that. So if you are, have a similar story to this woman, I beg you to please go on the Menopause Society and see which doctors are trained in all of this. So like, I will admit, I don't have my certification yet. I'm working towards it. But I'm still on the Menopause Society as someone who is a member and treats this in women. Men, they have low T and they have people who are prescribing them hormones all the time. Like, for example, when men have to have an orchiectomy, which is like anything that would cause removal of testicles, say with like testicular cancer, they almost immediately get put on testosterone supplementation. But when women have to get hysterectomies and get their ovaries removed, they are not put on hormone treatment and they suffer. So like, I am raging a little bit. Sorry. Actually, no, I'm not sorry. I take that back. I'm not sorry. I'm raging and I'm very angry because I don't think women's health is researched enough or taken seriously enough. I don't think enough people do the extra training that you have to do to be able to take care of women, which it's garbage that you have to do extra training. It should be just taught in medical school and it's not. And so anyways, if you sound like that woman, please go on the Menopause Society and look and see which physicians are out there who are going to take care of you and kind of know what to do with you. And like checking hormones is not one of them. It's not even recommended in perimenopause. So that's all. I'm going to finish making this sandwich and then deliver this to school because, you know, I wanted to do that today too. But that's all. Take care, stay healthy, and women, don't suffer. Get help from doctors who are trained in this.